This is fun.
I just put it down there. This is true.
The spooky lab, yeah.
Okay, let's have a class. So today's work, we're gonna test the urine sample. So it's one of our very fun and very cool clinical lab. We lab 14. That's called the urine microbial testing. Okay, so first of all, what we are talking about is one of the very common symptoms happen for our everyday life. Lots of people have it, called UTI, urinary tract infection. Now, urinary tract infection, there are lots of reasons will cause it. From the microbiology standpoint, the major causing pathogen is very simple, and everybody heard about it. It is E. coli. It is responsible for 80% of the UTI in the United States. Of course, the one what we learned before, Klebsiella pneumoniae, could be, but not that much. And the Enterococcus facilis or facilium will have a little bit urinary tract infection, but not that much. So the number one is E. coli. So we sometimes the E. coli cause urinary tract infection. We also call it urological E. coli. Okay, so it's very simple. Now, what are the reasons will cause urinary tract infection? And what are the symptoms? The symptoms is very straightforward. We call dysuria. That is a terminology describe the symptoms of urinary tract infection. Very simple. It is just say difficult to pee. So you may have burning feeling during the urinary tract taking out of the urine sample. You may feeling it never ends. You may go more frequency to the restroom. All these things, or you have a burning feeling, you have a feeling about the heart. It's all called dysuria. Now, what are the reasons will cause dysuria? The first reason is being female is the major reason, because the female urinary tract is much shorter than male. So that means it's a more accessible chance for bacteria to infect it and cause the problem. So being female is the first reason. And we had the surveillance results showing that it will be 90% to 10%, 80% to 20% the chance the girls will have urinary tract infection compared to the boys because of the short urinary tract. Okay, so if you want to say it's a short UT. Second is hold on pee too long. So let's say there is a basketball game or football game between WVU and the University of Pittsburgh, and you're in the stadium like 2 hours and you're very excited. You don't want to go to restroom. If you keep doing that, that's not very good. That's hold on to pee too long, will causing the migration of the pathogenic bacteria. Third reason, we call it catheterization. This is related to the hospital-acquired urinary tract infection, the catheter. So which is a pipe putting the patient's the urinary tract for them to taking out of the urine sample. But those pipes, they're not going to be refreshed all the time. Sometimes about a week, 10 days, they're not being refreshed. If they do not being renewed, what happened? The molds and yeast will be growing there. So this is also the fungi caused urinary tract infection. We call it a castration. Castration. Now, last reason, of course, you have a kidney disease. You have a kidney cancer, you have a kidney stone, and all kinds of things. The filtration membrane system has been broken. That also could cause dysuria, which is a urinary tract infection. Okay, so these are the very brief introduction about what's a UTI. So what we're gonna do today, we're gonna do is a human-made sample, and also could cost using the real urine sample to do the testing. So what we are looking for in the hospital when they do, if people have the dysuria symptoms. So when you go to the hospital, if you have a dysuria symptoms, the doctor will give you a urine cup to get a urine sample. And that is called casual urine. That's called a casual urine testing. In opposite to that, we had a clean catch urine. That is, which means more aseptic procedure needs to be done. But usually, you go to see a family doctor, they'll just do a casual urine test first. So the first thing what they do, of course, you're gonna go to the restroom to get your urine sample and in the urine cup, and then they will do the first test is put a urine strip. So what are the urine strip looks like? This is the urine strip test looks like. You're gonna take out one sample and then insert into the urine samples, your urine solution, about like 30 seconds, and they took it out. And then we're going to compare the color sheet or color figure on the side of the cup. Now, there are lots of the items there. You can see there is a leukocyte, nitrate, protein, pH, blood, ketone, calcium. There are lots of the indexes there. What are we looking for? From the microbiology standpoint, we are not looking for everything, but we are looking for 3 major markers to indicate you have bacteria-caused UTI. Number 1 is blood. If you are showing you blood in the urine sample, based on the test strip results, that could be one of the reasons you have UTI. The second, what we are looking for is leukocyte, or we say white blood cell. We are not looking for real white blood cell. We are looking for white blood cell enzyme esterase. This also tells you there is a UTI could be come out. Okay. What else we are looking for? We are looking for nitrate. Nitrate usually here, and nitrite. Let's say this test strip is on the second column. In this one, it is also second column. This one is on the third column. And what we are looking for is lots of the time we have this NH3 reduced to NH2. So what happens is we daily take some of the meat products. Let's say turkey breast, ham, summer sausage, those meat products, when they manufacture, they're using sodium nitrite as a preservative. So in your body, more or less, we have some nitrate. And then, if the bacteria grows there, what will happen? Nitrate will reduce to nitrite. That indicates a bacteria is growing. So, based on the test strip results, you have either one of these are positive, or all of them are positive, or two of them are positive. We will say it is presumptive UTI. But from a microbiology standpoint, we need to do the confirm. So how we do the confirm? That's what we learned already using bacteria agar media. And then they differentiate two different levels. The first we call it a qualitative test. Qualitative test, we are testing presence, absence of bacterial cell. By the way, our urine sample should be sterilized, which means it shouldn't have any bacteria there, ideally. So how we do the qualitative test? We will do two agars. Is McConkey agar and the blood agar. So you have a urine sample. Your urine sample, we are using loop to streak plating onto blood agar and McConkey agar. And we want to see the presence absence. So what this tells us? On the McConkey agar, if we do a streak plating, and you see a colony gonna grow there, and especially when you see those colony, which is a pink colony, what this tells you? Lactose fermentation positive. And it's absolutely is gram-negative bacteria. So very possible it is E. coli. And on the blood agar, what we are looking for? So we streak there. If you see some beta hemolytic transparent colony, it's going to be tells you have bacteria is very invasive. So that could be because something migrated from the kidney area. So this tells you is there bacterial cell on your urine sample. Okay, then how do we know how many bacteria are there? We need to know how the amount. This move on to the next level is quantitative test. The quantitative test, we're going to using a very general neutron agar. So how we do it? We're going to using loop again. To catch the urine sample. And then we to do a very intensive but gentle streak plating, cover the whole neutron agar. So this is a neutron agar. Once you have a loop to carry on the urine sample, and we do very intensive. And then turn 90 degree. We do a second gentle streak. And then we could do 35 degrees Celsius incubate 48 hours. Or let's do this time, 25 degrees Celsius, 5 days. And we are trying to see they are colony growing there. Now the question will be, if we get a colony growing there, we can go ahead to count. But what is the standard for UTI? In the clinical area, we using the standard is if you have more than 100,000 CFU per ml in your urine sample, it will be clinically diagnosed as UTI. Now, how we get this number? We get a loop to carry the urine sample. We approximately think this amount is about 0.001 ml. In other words, 0.1001 ml it equals 1 divided by 10,000 ml. So the dilution factor here is 1,000. And then you count the colony there. So for example, this is a urine sample, get from the patient. So you go ahead to count. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. We get 21 colonies. So how many total bacterial population there? This equals 21 multiplied by 10,000. That is 21,000. Is this patient clinically diagnosed as UTI? Not. It's not. Because this is less than 100,000 standards. But they may be developed, they may be getting there. So this type of patient needs to do a 2 months or 3 months revisit of the doctor. But if you have one patient has 200 CFU of the neutral agar, then how many bacteria there? There will be 200,000 CFU per ml. And this is much larger than that. And this number is more than 100,000 CFU per ml standards. So this patient will be diagnosed as UTI. Okay? So, from microbial standpoint, the testing is very simple. Okay, what we going to do today? We will have most of you is using mated urine sample. It's mated, diluted, inoculated urine sample. Everybody do it individually, but the test strip you do it as a pair. I don't have that many. So the first thing first is when you have the urine sample, of course wear your gloves. You have to hold on like this. Okay, put the urine strip completely inside, even a little bit of angle here. Okay, about 30 seconds. Then took it out. and you will see the color change. The color change, you go here to the front desk, or you can bring the bottle with you to compare the color sheets here. We are not looking at everything. What we are looking for is the first item, leukocyte, white blood cell. Second one, nitrite. The last one, what we are looking for is blood. Okay, we want to see is positive or negative. You can record this on your notebook. So that's the first test of what we're going to do. Then, everybody grabs 3 plates. A McConkey agar and blood agar, you do a very general strip plating. And we will to see the presence, absence of the bacteria. This is called qualitative test. And then you're using a neutron agar, using these methods, very gently to do the quantitative test. And all these plates you need to label very well and also put on your tray. We're going to do the observation on Tuesday to see the number and the presence, absence of the pathogen. Now, in order to be not contaminated with your bench or with the other environmental, today we will be using plastic loop. Okay, which is already been commercialized, pre-autoclaved, not really autoclaved, pre-sterilized loop. Ideally, there's no bacteria. So you're gonna pick from here. Okay, I think we're gonna left 1 box for every bench. So most of the people are gonna do this. Then, we also usually in the lab will let students to do volunteer to test your own urine sample. Who wants to do? Very good. You saved you $25 copay if you go to see a doctor. Who else? Who else wants to do it? Nobody?
Christian does.
Nobody wants to do it? Okay, it doesn't matter. We have to. Okay, how are you guys gonna do? You guys gonna go to the restroom to get your urine sample. You know how to do it. And this slip, you take it out. Okay. Once you come here to do the urine sample, you do it individually, which means you don't bother your bench partner. He or she will do this medical urine sample. You do your own. Okay, so you get McConkey agar, blood agar, and neutron agar. But be very careful is that you can use in mine, you can use in this loop, or using a new sterilized loop and make sure there's no contamination. And be very careful when you do this, have the paper towel with you, okay? Once you go in and took it out, then you compare. And you can take one with you and you can compare like that. And when you finish, cover this with this whole thing, throw away in the restroom. And don't left it on the bench. Okay? If any drops happen on your bench, clean it right away. And also, don't do these things like this. Okay? It's going to spread everywhere. So, once you finish, throw them away. Test the strip, the paper towel, to the restroom immediately. Okay? And we will be, say, patient 1 and patient 2, and we will be sharing your results on Tuesday to see is there any positive or negative. Final call, who wants to do it? One more chance.
Olivia does. No, but.
If you want some privacy, okay, one more thing. If you want some privacy, this is what you can do. Okay, nobody can see you, can see it. Okay, or double layer. If you want some privacy, and then you do. Now, usually also we look at the color first, ideally. It should be like a tea, is that right? Light yellow color. If you see the blood comes out already, then there's a problem. So we usually look at the color first. But if you want a privacy, you can do like this. Okay? Very good. Okay, let's go.
All right, I'll be back.
I'll buy it.